Maybe you've noticed your horse just isn't walking right. This could be caused by a condition known as equine lameness. On this episode of the Paw Report, we traveled to the University of Illinois Veterinary Teaching Hospital to visit the large animal clinic and learn how doctors and farriers are working together to ease the pain. Stay with us.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Thank you for joining us for this episode of the Paw Report. As you can see, we are not in the studio. We have packed up the cameras and we've hit the road to travel to the University of Illinois Veterinary Teaching Hospital, and we're visiting the large animal clinic. And our two guests today are very special. They're first timers and they're going to introduce themselves to you here in a moment. We have Dr. Sarah Gray and we have Tobias Ellis. So thank you both for joining us. Today we're talking about the equine surgery services. We're talking about the Farrier services and really actually how those two services work together in helping horses. So thank you so much for joining us. Dr. Gray, we'll start with you. Tell the viewers about yourself.
Well, I'm Sarah Gray. I am a boarded equine surgeon here at the University of Illinois. I am actually from North Dakota, so quite a bit colder, quite a bit further north. I went to school at Iowa State for both my undergrad and vet school, where I really got into horses. I helped train some horses for sale in the summers, and I worked in a testing barn for race horses and things throughout vet school. And I graduated veterinary school in 2015. After that, I did an internship in Texas, so went a lot further south with a lot of Western performance horses. Then I did a surgical internship out on the East Coast for a year prior to coming to the University of Illinois in 2017. And for 2017 to 2020, I did my surgical residency training program. Then I spent a year doing surgery work back out on the East Coast in Virginia.
You've been all over the map.
I have. Followed by a year in Indiana doing emergency work before finally coming home to the University of Illinois last summer as a faculty surgeon.
And we're glad your travels have taken you back to Central Illinois. Tobias, tell us about you.
My name is Tobias Ellis. I'm a certified journeyman farrier. I'm originally from Oregon. I went through Oregon State and the Lynn Benton Community College Farrier program back in 2000, and then started my own farrier practice. And I worked out in Oregon until this last year. I ran a multi-farrier practice. We drove all over Oregon, parts of Washington, a little bit of Utah, Idaho, into California. So there was like 5 of us working all the time. And last year, the University of Illinois offered me a job here helping run the farrier service. And so my wife and I packed up and we're now here.
Packed up the truck and you headed to Central Illinois. Yeah. Well, thank you both for joining us. It's always a pleasure to have first-time guests with us, and we want to make sure that we have this experience as good as possible for the both of you so that we get to talk to you down the road in the future. But we are here at the large animal clinic at the University of Illinois, and a large part of the veterinary teaching hospital is equine medicine, equine surgery. Can you talk about where we're at and maybe the services that go on in this building and the different types of horses that you treat?
Yeah, so in terms of the services that we offer, so we offer quite a wide range of services. Specifically on the surgery side, we see a lot of horses for lameness, which we're going to spend a lot of time talking about. We do a lot of elective orthopedic procedures. We do emergency type surgeries such as colics and fracture repair. If there's a surgery out there, we probably do some version of it. We also do quite a bit of internal medicine through a different service, but so we can do things like looking for ulcers and scoping upper airways to look for problems. So there's quite a bit of services that we offer. And with the horses, we see all types of horses here, everything from small miniature horses to large drafts, from your average everyday trail riding horse to performance athletes, and we have quite a few standardbred race horses in the area. So again, if you name it, we probably see it. We've had a fair amount of zebras and donkeys even.
Oh, wow.
So we see quite the range of equine species.
And this is where they come. We're in the large animal clinic, or at least a portion of it.
Yeah.
So the farrier, there may be some viewers out there that's, they might be city slickers and they may not know what a farrier does or what his job entails or her job entails. Can you tell us about the farrier and some of the things that you take care of?
Well, a farrier is basically we're a nail tech, right? So, but more even than that, we also are looking at balance and structure and how the horse is standing, and so we get to, off of the radiographs, off of supporting our veterinarians in the conformation of horses and posture of horses, and what the horses are doing, like Dr. Gray said, from performance to back pasture pets to so horses wear different types of shoes. And so we go in and we evaluate a horse's foot and we trim excess nail off, basically, is what we're doing. So we need to know how much to leave so that they're not too short, because if they're too short, it's no different than our own fingernails or toenails. Like if we trim them too short, it hurts, right? Leave them too long, it can become leverage to tendons and ligaments and bones. And so we're trying to find that perfect balance, right? And so our job is taking care of that nail structure. And then we decide what the horse is doing for a job. And then we have all different types of shoes, no different than what we have for people, from athletic shoes to sandals to, and we make all different types of shoes out of all different materials to specifically for each horse and what the clients are doing with them.
What kind of problems do you see? I'm assuming you encounter, a lot of different things, wall cracks, chipped hooves, things of that nature.
We have.
You probably see a lot.
We see a lot. So a lot of overgrown toenails, chips, cracks, overgrown frogs, thrush, infections, abscesses, puncture wounds, poor nutrition, poor nutrition on one side from not having the correct feeds to having way too much. A little bit of everything.
Dr. Gray, can you expand upon that? Because you probably see that and more too in the surgical area.
Yeah, I think all of those things, foot abscesses are a really common cause of foot pain in horses. Navicular syndrome is something that we see quite often that we're both usually involved in treating. White line disease, so that there's quite a bit of, even though a horse's hoof maybe doesn't look all of that complex, there's quite a bit of complexity in the hoof where they have some areas that can get injured that need some support from potentially one or both of us as we go about treating them.
And it's funny that you said the both of us, and that leads into my next question about the two of you work very closely together. And I guess in doing research, I thought of an equine surgeon and a farrier. How do these two, come together and help horses? But you two work very closely together. How does that dynamic work?
So specifically, we use the farriers a lot when we're dealing with horses that have a lameness issue, because quite a bit of lameness comes from the horse's foot. And so as we diagnose the problem, once we have a problem figured out, we often work with the farriers to try to solve that problem. So if it's something where there's a specific type of shoe that could support the specific problem, or again, maybe there's an infection that it's helpful to have the farrier can help us get some of those deep infections, or maybe he finds an infection and says, oh, this goes a little deeper than it seems like it should. Maybe we should get the surgeons involved to take some radiographs and make sure there isn't an underlying issue, more of an issue. So we work quite a bit at the intersection of lameness. There's surgeons and farriers together.
And this is probably somewhat new to you. I mean, working with surgeons this closely on a day-to-day basis, given your history and coming to the University of Illinois. How was that kind of different in your everyday duties?
Yeah, so before I worked around and with surgeons and with different vet clinics, and so I worked for about 7 different vet clinics, but most of that wasn't, we talked on the phone about cases, and here I get to be involved. Dr. Gray calls me when she has a lameness case, and I get to go watch it walk with her, right, and watch it with the students, and so I get to watch her diagnose the problem. And so we get to see it all the way through, right? My job as a farrier is not to diagnose, right? I leave that to the doctors to get to do and the surgeons to get to do. Our job is to help support that diagnosis. But in the whole learning process, before, I would get called in after all that stuff was done and get told about it. And so now I get to be part of it the whole process. And so it's not playing telephone, I guess, would be my best thing. Is there's steps that I don't have to miss or ask the wrong questions with. I get to see it all the way through, which is, man, it's a learning process, and it's so much fun.
Excellent. We've talked a lot, both of you have mentioned the term lameness, and I think that gets to the root of our interview today. What is equine lameness?
So lameness is technically defined as just any change in a horse's gait. We tend to think that that's related to pain. However, it can be something like a mechanical reason that their gait has changed,
and that's their walk, right?
Gait is their footfall pattern, whether that be at a walk or a trot. Or something higher like cantering or loping, where they're going a lot faster. We actually tend to evaluate lameness at a trot, because that's the most symmetrical gait that a horse exhibits. So it helps us pinpoint where we can see that asymmetry and difference in gait a little bit easier.
What are some of the symptoms that you see if somebody phones the hospital and they just don't think something is right, and they bring, or you do a call and you see the client? What are some things that you notice that you're instantly like, yep, that's probably the problem?
That's a great question. So people will sometimes think of lameness as the horse has to be visibly limping, and lameness can be a lot more subtle than that. It can just be they maybe don't want to put quite as much weight on one of their limbs, or it could be that they don't want to perform quite as willingly, or there's a certain move, if they're especially a higher athlete, that they're used to perform that now they're unwilling to do. So it can range quite a bit depending on how severe the lameness is.
What causes it? I mean, I'm sure there's several different things.
Yeah, it's really dependent. So lameness can essentially come from any joint or any structure within the horse's musculoskeletal system. So really the possibilities are endless. We do know that a majority of lameness in horses comes from their distal limb or their foot. It's something about 90% of lameness can be isolated to a foot.
Is it genetic, or is it maybe some sort of trauma, or can it be both?
It can be both. So something like a horse stepped on a rock and maybe has a rock or a sole bruise, or some horses have something called navicular syndrome, which is a little bit more of it's something similar to osteoarthritis, but it happens within the foot, and that has more of a genetic component to it. So again, the possibilities are endless.
Mm-hmm. Now, how did the two of you go about diagnosis? You work as a team, but I bring my horse in, and kind of take me through that process.
So we do an overall examination, a good baseline physical exam, palpating the horse everywhere, really feeling all of the tendons and ligaments and seeing if there's somewhere where your horse seems to be sore as we're feeling it. Mm-hmm. Then we do a lameness exam, which is we watch your horse walk and trot and move so that we can try to find that asymmetry. Specifically when they're walking, we really like to see how the horse's foot is falling. Are they even? Are they symmetrical? Are they landing, the way that they should, or are they landing more on the outside of their feet versus the inside? Mm-hmm. And like I said, at a trot, when we move up to ask them to go a little faster, we're looking to see, do they have a head nod? Are they symmetrical? How are they moving? Mm-hmm. We often do flexions of the horse as well, which is we'll put a little bit of extra pressure on some of their joints and ask them to trot again to see if the horse is sore. Something similar about if you were to crouch down and then take off running afterwards, it would maybe say, your knees are a little sore. You seem to not like that. So,
right. So once you compile all of that information after examinations, then the two of you work together then to come up with a treatment plan, or what does that look like? We will usually do a little bit more diagnostics work as well. So once we have an idea of what limb is lame, we do some perineural anesthesia, so we sort of block out the lameness, so we can say, okay, this lameness is in the foot. Let's now do some imaging. So we'll take some radiographs so that we can hopefully come to an actual diagnosis. Once we have an actual diagnosis, so we'll say that maybe the horse has foot pain, then we can come together and figure out, okay, so this horse seems to have osteoarthritis. How can we help support this horse? What sort of therapies can we use to best treat this osteoarthritis? And then is there anything that we can do trimming wise or shoeing wise that can then help support that? And I'm assuming that could be very vast, as far as it's not one size fits all, correct?
It's not.
No.
So once the diagnosis, the veterinarians come up with a diagnosis, and then we make a plan for whatever, if it's osteoarthritis, if it's navicular syndrome, and then we look at the foot itself, so basically the nail structure, right? And what we can do trimming wise to get it back balanced. So if the hoof is unbalanced on the because of how it's moving, whether lameness or pathologies, right? So we come in and we can trim it, and if we can't get the desired result that we want with the trim because we can't take off enough foot to do that, we can put a shoe back on it, and then we have to decide what type of shoe is best supports and protects whatever the osteoarthritis or navicular syndrome or laminitic cases. So and so there's shoes with rockers and rolls and taken off edges and pads with different supports and wedges, and so we can build basically the correct mechanics back into it that we think would support that. And the biggest thing I'll tell you with that is we may think all of that, we may like all of that, and it may look really good. The horse also has to decide that that's okay. And that's what's really fun about working here is unlike my other business, I also get to see stuff a lot of times sticks around here for a few days after we work together. So we get to actually see, I get to see it day 1, day 2, day 3, and then it also normally comes back for follow-up visits. So I get to see not only the beginning process with our doctors, I get to be part of that, but then I get to be part of building whatever I think and the doctors think will help support that. But then we get to see if the horse really buys into helping it. And so we can make those little subtle changes if we need to the shoes.
Do either one of you have a fear? I mean, you work around such large, beautiful animals, and sometimes they might get a little cranky, and it might hurt. Is there a fear factor at all? I mean, do you worry about getting kicked or bit or any of those things?
I mean, it's certainly
You've been doing it long enough.
Yeah, I think it's something. It's sort of, it comes with the territory a little bit. We have excellent handlers when we're doing things like this, which is helpful as we're doing our lameness exams and things like that. And we also have a little bit of a sense of a horse as as you start working with it, you get a little bit of a sense of them. So, and it's through the years we've been able to figure out how to keep ourselves safe while doing these sorts of jobs. Certainly, we probably each had our fair share of injuries, but we do the best to keep ourselves
prevent
safe.
that.
Yeah.
Well, what does recovery and management of the lameness, what does that look like for people once they leave here and go back home? Is it a lengthy process?
It again really sort of depends on why the horse is lame. There are some soft tissue injuries need more strict rest and rehabilitation versus some things like osteoarthritis. It's a little bit better if the horses can be moving around. So it's a little case dependent. Again, we try to get horses in for a recheck so that we know if they're responding to our initial therapies. However, we work with a lot of other veterinarians and other farriers in the area, and so we're in good communication with those folks as well to say, hey, like let's figure out. Maybe they do the recheck and sort of let us know how the horse is doing, or the horse again periodically will come back for some maintenance. As we wrap up our interview, we have a couple minutes left. I have to believe that there's some memorable clients that both of you have treated, may still keep in contact with their owners. Maybe it was one of those clients that you scratch in your head like, oh boy, this is going to be a difficult case. Any come to mind? We actually just recently had a case. It was a premature foal that was born that he initially wasn't doing very well. The internal medicine folks got him healthy. They spent a lot of time in TLC with him, but one of the problems that premature foals have is their tendons and ligaments aren't as strong, and so he's what they would call, he had tendon laxity. So he, instead of standing upright like a normal foal, his fetlock joints or his ankles were more towards the ground, and so that involved a lot of people working together. And so Tobias made him some
pedicures, I'm assuming.
And he made him little extensions so that he could stand more appropriately, so that he could start getting some strength back and being able to walk around like a normal little foal.
Yeah. Tobias, what about you? Any memorable clients or cases or situations that come to mind?
Yeah, like the fun part with like Buddy, it's normally I wouldn't, because of my old previous job in Oregon, right, working out on my own, I wouldn't be involved in that. And yet I got to see him all through internal medicine, working on him and doing stuff and asking. And then when when they asked me to come support and see what we could do, like I wasn't sure, like we can't nail shoes on a foal that's that young and do stuff. So how do we go about that? And so it was really fun because I got to come back into the shop in here and come up with what to do and how to try something. And so like and it was fun because our interns and students, I showed up there and they helped me, and I ended up I built some toe extensions for them and put them on all 4 feet, and we ended up elasticoning and taping them on.
Oh my goodness.
And I wasn't sure, right? It's one of those, and then the next day I get a text message from one of them saying, "You can't believe he's standing, he's doing so much better." And then you hear, "Man, he got to go home." And so getting to see that process all the way through and getting to be a part of the piece of the puzzle to be in that, like, it's exciting. I'm excited to be here and be part of a team.
Well, I say that's a fabulous way to end this interview today on such a great story. And thank you from the crew of the Paw Report for inviting us and getting us all set up here at the Large Animal Clinic to talk about, well, lameness for the most part, but also sharing information on the surgery services and the Farrier services here at the University of Illinois. Dr. Gray, Tobias Ellis, thank you for joining us.
Thank you, Kelly.
For having us.
And that wraps up this edition of the Paw Report. We thank you for heading on the road with us to the University of Illinois Veterinary Teaching Hospital here in Champaign-Urbana. Until next time, I'm your host, Kelly Goodwin.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.